interviewing one of the greatest in perio, one of the up-and-coming periodontists, Dr. Fadi Hasan. He's from Virginia, close to Washington. There he is! What are you drinking?
I'm drinking tea.
Oh!
I'm drinking mint tea, not a margarita, I swear to God, mint tea.
It was perfect to choose born in the USA, but we were not born in the USA. Although we are very grateful for the opportunities,
Absolutely,
that we have in this great country. I want to take it way back, okay? I want to know about how it all started. I want to know how and why you chose dentistry as a career, and then how you continued to immerse yourself in our beautiful periodontal and implant surgical profession.
So for me, actually, I never wanted to become a dentist. My goal was to be actually a cardiothoracic surgeon. That was my goal.
Oh, wow.
Since I was like maybe, to be specific, I think like since like 11 years old. I was a young kid and my dad had an MI and I was very young. So I saw him in the hospital bed when I was 11 and then I was like, just seeing him in that bed at that time, it just kind of, I was like, I definitely want to be like a cardiac surgeon. And, I'm from the Middle East. So for us, I'm sure you know this, but when we finish high school, we go straight into professional school. So that's dental medicine, all depends on your GPA back home.
Okay.
So my GPA was 0.1 from getting into med school. And I got into dental school. And I remember my father was so happy. He came to me, he's like, congratulations, on to dental school. And I was just pissed and upset. I was like, screw this. I don't want this. I was like, I want to be a medical doctor. So, but amazingly is that once I started my first year dental school back in Baghdad, again, this was 2002, was when I started dental school. I found like, okay, cool. Apparently I'm really good in like dental anatomy and carving teeth and all that stuff. And my faculty at that time was like, you're really good. I think you should, kind of just be like a help us assist like for the next year students. So every year until pretty much I was in my senior year dental student, I had just a reputation of, first year dental students come to me, hey, can you teach us how to do dental carving? And it just went on. So I found out apparently I'm really good at dentistry and I love my passion. And that was got me to dentistry and I've enjoyed it ever since.
Well, it sounds like you were destined to be a surgeon, not a cardiothoracic surgeon.
No, not a but it would have been cool. It would have been really cool. I would love to have been in that profession for myself as well. But again, I just love the surgery part of it. And I think as all fresh dental students, what's our goal? I want to be an orthodontist. Why? Because I think my mentor back in Iraq, he was an orthodontist and such an incredible human being. Very calm in his demeanor, the way he talks. And so when I got to dental school at that time, I was talking to him, like, I definitely want to be like you, an orthodontist when I grow, since I'm already in. He gave me one incredible piece of advice, and I like to share that with all future graduating dentists who want to become professionals, like as far as, becoming also specialists. He said, Fadi, if you ever want to be a good specialist, you have to be a good dentist first. So I love that word from him. And I remember when he told me I was 18 years old, I'm 41 now, but I still remember that word that he said to me like almost 23 years ago. And I carry that till today. It's like, if I ever want to be a good specialist, you have to have your basics of dentistry, understand it, and see if you want to go into specialty, then at the end of the day, we are dentists, really dentists first. And when we get into specialty, we can be more tunnel vision. We have to always take a step back and look at the bigger picture, and then we look into our specialty a little bit deeper at that time. So, but 2 years ago is when I started to open my own practice, and I've done it all. I've done traveling periodontics. Used to work 6 days a week for the first 9 years. I just stopped 6 days literally last June. June 1st is the last year is when I really stopped the 6 days a week model, and it was just exhausting. And I was like, I'm just missing so much time, from family, kids, and all that stuff. And I was like, being my own boss, and 2 years ago is when I decided to open my practice. It was a great decision. I wish I did it sooner, but yet again, you never know what the situation might have been. I don't think I knew much about as far as running your own business, and I don't think we ever really know. If some people are just incredibly street smart and they just know the whole aspect of how to run a business. Some of us who are a little bit on the nerdy, geeky side, we're just about books and Perio and managing people in an office and a business is a very total different avenue for yourself. But again, you learn along the way, and as long as you have good colleagues and good friends that you can talk to, older or they're younger as well, that you can listen to their experience, what they've done, what's anything different, what courses have they taken, what was it whether it's themselves or their teams. All these things help you slowly grow, and you slowly start applying it into your practice. And I mean, I think we're all blessed. I think each and every one of us in private practice, we have that small group of very, very close colleagues and that we call them friends and brothers and sisters, and we reach out to them. I have a question, can you help me there? And they never say no. So that's amazing. That's what beautiful thing is about it. And
I'm glad that you shared that with me, because I've interviewed several doctors that have mentioned and expressed that sometimes it can be lonely in private practice because you're in this own bubble, right? And what I'm hearing is that it's essential, if not crucial, that you have that support system of colleagues that are older, younger, or just going through it just like you. What has been some of the challenges that you didn't think you would face with entrepreneurship and starting your own practice? You're 2 years in already, so you've been through your fair of challenges, I suspect. So what was something that kind of caught you off guard?
I think anyone who starts a new practice is always going to tell you it's always about team management. Is that choosing the right people in the right seats? And I think that's the most important thing. It's never easy to you hire someone. It's never easy to let them go. And that's always a challenging part, because for me, I really care about my team and people that I bring on board. I want to see if can I keep them, and can they stay with me for the next 5-10 years as we start this journey. And I've been lucky. I've had so far, a few team members who they've been with me from day one, when I still had, pretty much when the bars were still up there, like just the metal beams, and they looked at us like, is this going to happen? It's like, yeah, just be patient with me. And 2 years later now, they're still there with me, and I'm very blessed to have them, and they believe in me and I believe in them, and it's a teamwork. And I tell them, this is as much of it is your success as it is my success. I couldn't have done this without you guys. And it's all about, you appreciate them, and you make sure they are worth their value, and and so that's what makes them think. I see them as family, and if they need something from me, I'm there for them. If their kids is sick or they have to take some time off, no problem. We'll figure it out. We'll rearrange the schedule to accommodate. And when you're starting new, you don't have a really big team. You might have 2 people at the most, and now we're a 14 member. So in 2 years.
Wow.
So we're slowly growing, and we're getting in that direction, and it's been a fun journey.
What's your practice model? Is it strictly Perio, or is it multidisciplinary, or what is your business model?
It's pretty much all Perio. It's amazing. I would say, but we have complex cases that walk in, and those are the ones where, if it's referred to us from, whether it's a restorative colleagues, whether it's pros or ortho, or even oral surgery, you call them. I call them, pick up the phone, text them. A lot of them have my phone number, and I just share my information with them. And for me, and again, if there's an issue, hey, do you have a minute? Sometimes I'll do a FaceTime. The patient's in the chair, and I'll FaceTime the orthodontist or FaceTime the prosthodontist. I was like, they're in the chair right now. Let's have a quick conversation, and just to have kind of cross the T's and dot the I's, just to make sure we're all on the same page. And that's the fun part about it when it comes to that multidisciplinary situation of it. I do sedations in my office. So in one case, we You know, it's like we had a very complex case, and I brought the endodontist in. It's like, I'm going to sedate for you. You do the endo part, and once you're done, I'll do the perio part because, you know, this patient has limited finances. We want to take care of them. So let's see if we can do this under one day and versus them visiting
Right.
several offices.
Right.
I have a microscope in my office, so it was great for the endo to come in, use the microscope, do their endo work, apicoectomies, all that stuff, and I'm just there sedating, and that was incredible fun. Like just that multidisciplinary team that you have there for this one patient was, it's fun, it's enjoyable to do, and
I want
becomes
to.
more like
I
it
want to
becomes more
dive
like
in.
a hobby.
Yeah, I want to dive in. You're very passionate about this, but I want to dive in into something that you mentioned. So your practice in particular, in my eyes, is very future. I haven't had the opportunity to visit you in person yet,
Uh,
but I've obviously seen
Please
it through
come.
Instagram.
I would love for you to come, and
Thank you,
you're
thank you.
gonna have a phenomenal time. I
Well,
promise you that.
I mean, what I've seen so far is very impressive. I've seen that it's very futuristic, very clean lines, you know, just spectacular. And one of the things I've noticed is that you're incorporating a lot of technology into your practice, like the microscope, obviously CBCTs. What other things have you incorporated, and what has been your favorite gadget? If you tell me, Zuli, if you're going to open up a perio practice, you need to have this into your practice because it
Okay.
has been transformational for me. What would that be?
I would say, I mean, I think standard as any practice. I mean, first of all, you should have an intraoral scanner. That's a no-brainer. So that's the first thing that I think I got maybe 6 months after
Okay.
I opened, is I got myself intraoral scanner. But for me, I opened my practice. My goal was to get really into the microsurgery, and having the microscope, and I'm able to record my surgeries, which I think you saw at the SAP. I was
Yes.
presenting one of my cases when you were there, and there was that surgery that was required for a vertical augmentation, block graft. That was done all under microscope, recording it, harvesting from A to Z. For me, I love that part. That's because I get to stream it on the big TV, and if I have some doctors, and that day actually I had a doctor, a prosthodontist, and a hygienist that was there, his wife, and they were in the other room. I have another room where I can actually stream the surgery to it as well,
Nice.
and they were watching the whole thing from A to Z, like live as we were doing it. So if you're into, I think perio, we're more into perioplastics. Let's just kind of call it that way. And for me, my passion has been always soft tissue. I love everything about just gum and finesse, and it's art for me the way I see it. With aesthetic crown lengthening, soft tissue grafting, around implants and teeth and all that stuff. Using the microscope, just going into that 7.0, sometimes 8.0 sutures, it's cool. It's just
Fascinating.
I love it. It's so fun to do. Like when I'm doing it, it's like, and my team they see me like how I get giggly about it, just like a
Yeah.
2-year-old who got his new toy. I think that giggle just never goes away. Like if you're passionate about it, it always stays inside. And
What are you
yeah.
what next advancement are you looking forward to? Is there anything at the cutting
Yeah.
edge right now that you're like,
So
I need to get
so I'm looking into getting another microscope this time. But so the one that I have is the Zeiss 300 Xtero. It's a 1080 recording. But now there's a new one which has the 4K quality recording, and it's really cool. It has like a joystick, so it's a continuous zoom in and out, no more clicks and dials and all that stuff. So it's really kind of more of a cutting edge, and they're coming with a new version of it where pretty much you wear goggles, and it's like you're looking like this, and you're seeing the whole surgery pretty much in front of you, and you're like just working like that. So it's really kind of like it's like a 3D image in front of you, and I think my understanding, you can even import the CT scan X-rays into it, so you can see everything overlapping each other. So that's kind of my vision for the next 12 months, I would say, if I dive into that a little bit, and that might be something really cool to look into and invest in the future. But we'll see. I'm going to be excited about it.
You know, Fadi, I have been following you for several years now, and one thing that stood out to me was, other than your exceptional surgical skills, was how you documented your cases. You were talking about it right now. In terms of photography, though, I want to know, and I'm sure a lot of clinicians that are tuning in right now want to know, if there is a tip, a trick, with managing all of the different, aspects of a private practice in terms of like administrative and, patients waiting and the workflow and everything. How do you manage to take pictures, edit them, store them, all of that? Is there a strategy? Is there a protocol? Are there systems in place? And
Not,
what would
to be
the
honest, I keep it very simple. I mean,
okay.
and I'll
Keep it
share it.
simple, stupid.
I'll share with how I do it. So I have
Yeah.
two cameras.
Okay.
One is a ring flash with flash cap from my good friend Jess Liu. I mean, I think every periodontist should have flash cap at this point in time. And Jess gave me a phenomenal trick. I was like, Jess, how is that your pictures are so clean all the time? He says, Fadi, I just use an air water and I just do a power wash before I take the picture. It's like, seriously, that's it? It's like, yeah, man, that's it. And I started doing it, and for like 2 years now, or 3 years, and I was like, oh my god, my pictures are looking so much better. And I called just like, just dude, thank you, man. I mean, I love this trick. So he's the one who told me about the power wash, and right before the picture. So that's your trick number one,
Okay.
is clean and make sure you power wash the area, and then you go ahead and take your picture. I love using like my ring flash for all my posterior cases because it's usually hard to, when you're doing retraction, you want to get there. So that's kind of what I use. Interior cases, I love using a twin flash. And I use, my Canon, my mirrorless one, with a 100mm macro lens, a twin flash, Godox twin flash, and a couple of diffusers that I attach to when I take my pictures. I take all my pictures. So what helps me with my cases and taking good pictures is I use Optragates. It gives me beautiful retraction, and I just kind of pull up a little bit for the maxillary mandible and take my one shot. I'm in the same spot. I take the same consistent shot if I can. And once I'm done with it, I have a hard drive. I will drop down all the pictures usually once every couple of weeks or once every 4 weeks. I will just upload it just to make sure all my pictures are well saved and taken care of. As far as editing wise, I use Keynote. I don't do anything to my pictures. I just put in my Keynote. I might rotate it a little bit right or left just so I can get everything perfect in the middle.
Right.
If it's dark, I might increase the brightness. That's the most I would do to it. And there's nothing else, because if you're consistent with your documentation and as far as your proximity to the patient, you will get consistent pictures. I use the same flash for my interior cases. I use the same flash for my posterior cases, and I don't change the settings. And that's something I learned from Jess. I mean, Jess was amazing in teaching that to me, and again, a lot of my great colleagues who do some beautiful documentation anywhere. I mean, my friend David Adley in Sydney, Australia. I have some incredible prosthodontists in Rockville, Maryland, who they do beautiful also photography courses about it. They teach about it. So that's how I got into it. You change your techniques here and there every once in a while with your documentation, but right now it's been kind of consistent for the last, I would say, 3-4 years. The only thing I'm doing is just updating my camera. Now I'm using mirrorless, and that's the new thing that I've been doing for the last maybe about 1 year now.
Okay, so no lateral mirrors to take. You just go on the side.
I've never taken lateral mirrors. I've only used a mirror if it was an occlusal shot, and it was like on a first molar, and I want doing an immediate. That's it. That's it. And I hate using mirrors because I have to change my ISO setup. I have to change my f-stop sometimes, and for me, it's like, okay, when I'm taking those same pictures again, it's like, what was my setup again? I put the patient back, open your mouth, lift your chin up, take the picture, and go back in, and go back again. That's been it's not the most comfortable way for your neck or your back, but it works well for me. But it's up to you how you want to do it.
I love it. So you mentioned previously during our interview that you go to VCU once a month.
Yes.
And despite the distance that you travel, almost an hour and a half to meet with future periodontists, are you in the GP or are you in the Perio program?
Grad Perio. I used to do pre-doc from 2016 till 2020. After COVID, they put me exclusively with the postgraduate. That's been great for me because I'm there the whole day with postgraduates, and my residents, they know me. It's like when I'm there, put every crazy thing that you can possibly imagine, put it on my schedule. I don't care what it is, we'll
Let's
make
do
it
it.
happen. So let's do it. I want to challenge them. So
That was
um,
actually my next question. How do you approach mentorship with these aspiring periodontists or
I
the
show them.
future?
I mean, it's all about passion. I just show them how passionate I am about this profession. I mean, we're lucky to be in this specialty. I love perio, honestly. I'm lucky to say that it pays the bills, but it's a hobby at this point in time. I mean, I'm living on it. It pays the mortgage, it pays my kids' tuition, private schools, and all that stuff. So it's my way of living. But at the same time, I enjoy what I do, and that's what I try to show to the residents is that are you in it for the right reason? And I think it's all about showing them when you're teaching them, showing them, how even 10 years into private practice that you still love it so much. And they see me say like, oh my God, this looks so sexy. And I use that word a lot. And even my patients now are used to it, unfortunately. And then it's like, and if I don't say the word, they think something's wrong. So I was like, is it good? Is it sexy, doctor? Like, yes, it is. I'm sorry, I forgot. I was like, I forgot to say it to you.
They want you to say the word
They
now.
want me to say the word now. So it's kind of,
Love
it's
it.
funny. Like I say something just like I'm not aware of it. It just comes out of my mouth. It was because like I'm so, and the patients love it when they see about the work that you do. Um, the feedback I think that you get from them is like, I love how you and your team are so passionate. And my team now, like my assistants, when they are with me, they also now are starting to use, and they get excited about the procedure and how it ends. So the patients there in the chair is like they get excited. It's like, oh, they feel like, oh my God, this guy's doing everything possible. And that's my goal.
That you care.
I really do care. Like when I mean, sometimes patients can be difficult. We've all experienced those, and sometimes daily. But when they're in the chair and I'm taking care of them, I see this case like, what can I do in my best to give them the most amazing outcome, and that's how I like to. That's how I want to kind of always strive for myself. And that's kind of, and I want to show that to my residents when we do my courses. I show them the same thing, is like the passion behind the work. And if they are able to see that, they appreciate it. Hopefully that kind of, you put something inside them, even a little bit of a spark, and it's like hopefully they take that small message and they can translate it to their patients. Then you've done a good job.
Absolutely. Speaking of courses and speaking of sexy tissues and sexy surgeries, let's talk about Perio Amigos.
Yes.
What is your role in Perio Amigos, and what is your goal with Perio Amigos?
Oh, good question. So me and my friend Dimitri, my brother from another mother, we were this was during COVID time, and mind you, I think this was our Thursday happy hours that we all sit down and everyone would get a drink, and we were sitting down doing nothing. So one time I was talking to him, it's like, dude, you like gum grafts? I was like, and I like gum grafts. Like, why don't think about doing a course about soft tissue grafting? And I was like, yeah, sure, man, why not? So we talked about it, and our first course was a year later in Philadelphia. And so me and Dimitri are the one who, I don't know who picked the name. None of us are amigos, I promise you that. I'm from Iraq, he's from Uzbekistan. We're both from the eastern side of the hemisphere, not from the western side of the hemisphere.
Oh, good.
So I don't know how the Amigos word came out. I think Perio Bros was taken or something like that. And I was like, let's just stick with Amigos, and it kicked off.
Like it.
Since honestly, we've done about, I think this is our 4th year now. We've just done our 16th or 15th or 16th course at this point in time. We have 3 more coming this year. One is in 3 weeks from now in San Francisco. We have one in DC. And we're bringing, now our goal is to bring international speakers. So, from Ricardo Kern, we brought last year. We had him again this year. We're bringing Johann Tunkel from Germany, talk about nothing but, exclusively for like ridge augmentations and block grafts and Cody techniques and alloplates. And at the end of the year, we're doing a course in Houston with, Todd Scher and Mike McGuire, which are perio gurus and gods, I like to call
God.
them. Like, I mean, so we were very honored to do it with them as well, for 2 days, and there's going to be a live surgery involved with it as well. So our goal for the future is, we'd like to start doing more international. So we're kind of in talks. We've done one international course actually back in 23 in New Zealand, and we're hoping we can, bring it again back there. And maybe in Europe if we can, or Canada as well. So we're having a couple of talks here and there with some of our followers actually, and some people who've taken our course who are international, and that's like, would you guys be willing to to come to Canada, or one of them said, can you come to UK, or some of them come to Egypt. So I was like, we'd love to. We need contacts there, someone to help us organize this. So as far as location and food and all that stuff that we want to make sure that our attendees have. So.
Right.
It's in talks, and we'd like to have that international spotlight at one point in time, hopefully in another year or so, or maybe longer. Again, it's a slow process. It's all about just building it right now. So it's only Perio Amigos is only 4 years old, but it's been blessed, and we're really enjoying it. Just being able to teach. The other 2 days ago, I was talking to a surgeon who took one of our courses, and it's like, thank you so much. I'm so happy I took your course. It's like, I told him, was it worth the ROI? I was like, you have no idea how many free gingival grafts I'm doing, and
Wow.
because there's no periodontist next to me, I'm the one that's doing it all. And I was like, awesome, man, I'm happy for you. It's like, yeah, man, it's from ridge augmentations. Anytime I get a ridge augmentation, I look at the soft tissue now, I evaluate it, and I'm doing. Exactly. I'm looking at the soft tissue component to it, and whether it's teeth or implants, I was like, I'm doing more soft tissue surgery, and I was like, your course was amazing. And this was, again, 2-3 days ago, when I was in my office, we were sitting down texting, and he was showing me another case. But I was like, hey, Fadi, how should I approach this? And he's one of our local amazing oral surgeon, one of our local doctors that I have known for so many years. But it's beautiful to see that, that people are really appreciating the quality and the content of the material that we're providing them, and it's very in depth.
Are you ever bringing it to Florida? I mean, come on, I'm waiting for you, Fadi. I'm waiting for you.
If the opportunity presents itself,
okay.
and if there's a location, and people can help us kind of just organize it. Like, I don't know where to do it in Florida, for example. So we do it in DC because that's where I live, and we do it in LA where Dimitri lives.
Well, you're planting a seed, so
we're open really to do it anywhere, as long as we're having a location and a place, and for us just to kind of get the logistics simply in, and that's what really matters to us. Is like, where can we do it in a place where it's easy accessible, people can come in, they can enjoy the area, enjoy the food as well, and being able to travel back, and that's what we'd love to do. So, I mean, if there's an opportunity in Florida, my God, we'll love to jump on the plane, and we'll do the marketing through Instagram and Facebook, whatever. It helps us to get the word out there, and some of our colleagues as well in the area. That's our goal is.
Amazing. I'm super excited for you guys. I think that there's so many opportunities for growth. You are so passionate about our profession and about education, and your attention to detail is exemplary, and I can't wait to see what the future lies for Dr. Fadi. So
I'm excited too.
I want to hear it from you though. What does the future hold? If we're gonna look back at this interview, they're gonna say, hey Zuli, you asked me what the future personally and professionally has in store for me, and then we're gonna look back and I'm gonna say, hey, do you remember when you said that, Fadi? You're gonna be like, yeah,
I think
what are those?
I think personally, what I would love is definitely not working 5 days a week. I like to do 4. It would be awesome for me. That'd be really amazing.
How old are your kids, Fadi?
My son is turning 13 in a week, and my daughter is 9. So I'd like to have an opportunity to spend some more time with them. I think they've just been busy with practice, courses, all that stuff, speaking engagements, so so it definitely takes a lot of your time and energy and away from your family, and I'd like to have that opportunity to, enjoy them while they're still young before they all end up in college and look back, it's like, crap, I wish I did spend more time with them. But, we're working for them. It's how we're raised. Like, So we want to make sure we provide them the best and the best schools, education, good lifestyle, hopefully, and they appreciate it as they grow up. Our parents worked hard for us, and I like to do the same thing for my kids as well. That's from a personal point of view. Professionally, I would be excited. Again, my practice is still a baby, so yeah, it's nice to see what's going to look like in the next 5 to 10 years. Reaching our goals. Having maybe a bigger team, a little bit bigger team, maybe an associate to take off some of the, when we get busy enough, someone to take off the workload for us. It gives me more time again to spend with the family. I guess again that's their primary objective. And whether from Perio Amigos, if we're able to continue on that path for the future and continue to kind of improve it year by year, life surgeries and all that stuff, that'd be an amazing thing to do. And hopefully going to that international circuit as well. And I love speaking engagements, so being on the big podiums in the future is definitely a professional goal for me. And cross our fingers, see where life takes us.
It's going. I have full faith. You're trailblazing and you're a rising star. You're already a star, but
we're trying honestly.
Yeah. Well, I look forward to your continued growth, and thank you so much, everybody, for tuning in.
Thank you.
We're going to wrap it up on this very special Memorial Day weekend. Thank you for joining us, everybody. Have a good night. Thank you, Dr. Fadi.
You're welcome. Have a wonderful day. Take care.
You too. Bye-bye.